Good evening. Thank you so much to HealthCell for inviting me to speak about your mass casualty response system. It is an incredible honor to be a part of the trauma system that's helped respond to caring for injured people. So your mass casualty response system actually is part of a larger system called the trauma system. And what that is a group of collaborative hospitals, organizations, working together to improve survival of injured people. Did you know that injury is the #1 cause of death in people ages 1 to 44? As a result of that, in 1998, the state of Texas mandated that 22 regions in Texas develop an emergency trauma response system. The Southwest Texas Regional Advisory Council, or STRAC, is our trauma response system in San Antonio and South Texas. It is a unique trauma system in that we are the only trauma system in the entire country that has a civilian and military partnership. We have knowledge from the battlefields that's translated into civilian trauma care. We use our civilian trauma care knowledge and translate that into battlefield, in working together to serve not only our community, but our entire country. And STRAC is the core center of that. They help navigate mass casualty situations, whether they're man-made or natural disasters, by organizing all the hospital systems and getting the injured patient to the right hospital in the shortest amount of time so that more lives can be saved. We're fortunate to have 2 level 1 trauma centers in our region: San Antonio Military Medical Center and University Hospital. But having those level 1 trauma centers won't matter if we don't have the collaboration of the other hospital systems that serve as the regional support for injured patients immediately to stabilize them before they can be transferred to a regional center. This didn't form over a day or two, it formed over decades. And because of that, because of this system, we were able to respond to one of the worst tragedies in Texas history, the Sutherland Springs shooting. Now, in a mass casualty situation, there will be people who won't make it to the hospital. 25 people died on site. There was nothing we can do, not even the most sophisticated of trauma systems. But the moment the incident happened and law enforcement was notified, STRAC set up central command in Sutherland Springs within 30 minutes, mobilizing all of the area hospitals, notifying pre-hospital personnel, air life transport, to get to the region so that the moment police can clear the scene, injured people can be transferred. That's an incredible short response. Well, some of you may think, well, there's the state and federal government. They're already set up. Why can't they help? They can't help because they're too far away. Every disaster, every mass casualty is a local event and response. And if you don't have a sophisticated system, you won't be able to save the lives that were saved that day. 21 injured people made it to the hospitals alive. And I'm proud to say that your trauma system was able to save 20 of them. That's a 95% survival rate in a mass casualty situation of seriously injured people requiring immediate operations, because the system was set up in a collaborative effort with multiple hospitals and pre-hospital agencies in collaboration with local hospitals to transport the patients, to get them to the right place in the right time, in the shortest amount of time. Ambulances were lined up within 30 minutes of notification that this incident occurred. Because STRAC was able to communicate at a broader level through MedCom, you heard about this from the last story. MedCom is the city's lifeline to getting the right injured person to the right hospital in the shortest amount of time. And they waited to transport these patients. Why? Because, as one of my favorite artists says, Band-Aids can't fix bullet holes. And so this child with multiple holes can be this child. Because of the organization that were involved in taking care of injured patients in your city, people who work together from University Health System to Methodist Healthcare, Baptist System, Santa Rosa, Connolly Memorial Hospital, all the regional hospitals, San Antonio Fire, San Antonio Military Medical Center, these children survived, and the 18 other people survived because of this incredible system. And I can probably quote you data on the number of patients we've saved, but I'm not going to. The best part about your trauma system was quoted by the National Academy of Science, Engineering, and Medicine. Because injury is the #1 cause of death and disability in young people, the National Academy actually put out a guideline for 0 preventable deaths after injury. And the way to do that is actually to get the injured people to definitive care as soon as possible. Well, who did they quote as the leading trauma system that is capable of doing that every other trauma system in the country should model after? Yours. Your trauma system in San Antonio. You should be incredibly proud of that. Because of the initiative between military and civilian collaboration, you have the best trauma system in the country, and perhaps the world. And that's based on survival statistics across the country. Your trauma system has been modeled in multiple conflicts across the world. And this trauma system of regional transfer, getting the patient to the closest hospital capable of taking care of their injuries, will improve survival. It's been shown over and over again. And it is not done without the commitment, the collaboration, and the people. So I leave you with the image of the people who are behind your trauma system, the founders, the leaders, the brain and the heart behind people taking care of injured patients in San Antonio and South Texas. And you should be incredibly proud to have that system in place if and when you need it. Thank you so much for your attention.